Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And joining me in the studio is Dr. Tanja Fischer, a dermatologist from Berlin. Welcome to In Good Shape. Hi,
hello.
Nice to have you here. What's the real cause for skin lesions and overcaring?
Often is that you just over-treat your skin, mostly if you use ointments which are just too greasy. It's putting like a film on the skin, and then you have those little pimples.
So is it all about the ingredients in the creams and ointments, or is it just the mass of it you just put onto the skin?
Both. The ingredients are the major point, because you have those people, they use too greasy ingredients, sometimes also parabens, which the skin doesn't tolerate, or too much perfume. But also they use too much, especially young girls, which should use more a moisturizing cream, use too greasy creams.
So I should have a look on the label of the cream and
Exactly.
What should I avoid? What shouldn't be in the cream, the paraben?
Well, if you've got the problem and have those dermatitis, then you should use some really moisturizing cream and not too greasy creams. But if you have a normal skin and you don't really have problems with the ingredients.
Okay, so and if I suffer from overcaring, when do I have to see a dermatologist? When I have to seek medical care?
It's just when you don't have an ending, when always more pimples come, you have those redness, then you have this kind of dry feeling, flakiness of the skin, and then you try to cream even more, and then you get bigger problems. I think that's the point where you should really go to a dermatologist.
And what do? They give me antibiotics or cortisone?
No, you shouldn't use cortisone, because it helps initially, and then afterwards you have even more problems. I think one of the major points is that you use less. Sometimes it's quite difficult because the patient wants to do something, and then the dermatologist says, don't use so much. But that's really the solution.
So I should just give the skin a break.
Exactly.
Don't do anything.
Exactly.
So for how long does it take that the skin recovers?
Well, sometimes it really takes like 4 weeks, and it's a really hard process because you go through this a period of really dryness and itchiness of the skin, and you really want to re-cream with greasy ingredients, but you shouldn't.
What about all this talk about skin types? Do I need to see a dermatologist to get my skin typed before I buy some ointments?
It makes sense. Mostly the people know quite good what kind of skin types they have. If they have more pimples and huger pores, or if they have a very delicate, dry skin with fine pores, then it depends what kind of skin type you have. And if you're unsure, you should always go to a professionalist.
Okay. The most obvious difference between the skin of a woman and of men is facial hair. And we have to shave. So what can I do to protect my skin when I'm shaving?
Well, if you shave, like 70% of the men shave wet. They make like a moisturizing shaving. And I think that's really good to help the skin prevent for itching, flaking, dryness. So it helps if you put some moisturizing after the shaving.
So when it comes to shaving, the wet shaving is better than the dry shaving?
For lots of men, it's better, because if you have a very delicate skin, it's good to moisturize before, so it makes the skin more softened, and it softens also the hairs, so it's easier to shave, and you have less pimples and side effects.
Okay, and what about the shaving technique? Do I have to stroke in the direction of the hair, or do you have to do it against the direction?
It depends on your skin type. If you have a delicate skin, you always should go with the growing of the hairs. So it means in the facial, downwards, and the neck upwards.
Okay, so I have to confess I'm a dry shaver, so I don't like all those wet shaving techniques. So do I have to prepare my skin for a good dry shave?
For the dry shaving, that means you've got a quite solid and good skin. So I don't think that you need any pre-treatment, but it makes sense to put a lotion afterwards. So you moisturize your skin. It makes sense to use like a vitamin B3. The most shaving after shaving creams, it's in there.
But you don't have to put some alcoholic solution on it for disinfection, so
no.
not to keep it clean.
No, I think that's a little past times where you thought you have to kind of make a disinfection. That's not really necessary.
It's all about moisturizing and giving the skin back all those...
Because also alcohol dries the skin out, so sometimes you have this burning sensation, then redness. You should put a moisturizer, perhaps with a good sun protection or sunscreen.
But what about all those pimples men have at the bottom of the hair?
Yeah, that's sometimes if the razor blade is quite old and you don't have a precise cut, and then the hairs is like an ingrowing hair, and then you get those pimples because bacteria stay with the hairs.
What I always wanted to know, can I just use all those creams and ointments of my wife? She's got so many, plenty of them, and I just have one little one. So what can I use?
Well, men start to use more cream, which really makes sense, but mostly they've got much greasier skin, so you should be careful that you don't use the too greasy skin of your wife, and it makes sense to use more moisturizer for men.
But there's so many products on the market, even for men, or especially for men. Is it just all about cosmetic industry, wanted to make money, or is it really useful to lose a lot of different stuff?
Well, it makes sense if you use a cream, but men's skin is very good, so you shouldn't overdo. It makes sense to use an aftershave with a good sun protection. I think that really makes sense.
Okay, we got a viewer question. Joshua Akran from Ghana, and he wants to know, he's grown up, he's grown up, and he still's got pimples on his face. What can you do to prevent
Well,
them?
it depends. If the pimples are in the beard region, he really has to look what he does, how he shaves. If it's on the forehead or somewhere else, sometimes it's due to testosterone, but sometimes it's also because men have to clean at least at night the skin just to get rid of all the oily stuff and the dust from the day, so it makes sense to have a good cleaning.
Okay, great. And when I want to have a very young, appealing skin, is there anything in dermatology in the pipeline, any new techniques to keep my skin youthful?
Well, it's not really new, but what really makes sense is to have a good sunscreen, at least like 25 or 30 sunscreen factor. And some of those hyaluronic acids, which are in ingredients, which just moisturize the skin very good.
So moisturize it, staying out of the sun. Thanks so much for being in the studio.
You're welcome. Thank you.